We are going to start with a few presentations to give you some examples of approaches that call themselves pro-poor, market-based, or that explore this question a bit. And then we are going to move on to have some discussion and comments from some perspectives from funders on this same topic. So looking forward to hearing, sorry about that. Looking forward to hearing thoughts from all of you and just hoping to bring in a few concrete examples to get us started. Thank you for your, yes, perfect. There we go. And then to advance, there we go. Okay, perfect. Great. Thanks again. Thanks for your patience. You all are super on it and ready to get started at 8:30 on Monday morning. Your facilitators getting there. So thank you. Thank you so much. Again, my name is Ruthie and I work with Fresh Life. And I'm going to tell you a little bit about what we do. First, for a bit of context, as many of you are probably aware, cities are growing, more and more people are moving into cities. And what that means, among other things, is that the sanitation situation is getting more and more dire. So we expect there to be 3 billion people living in informal settlements by 2050. In Kenya, which is where Fresh Life is based, 10 million urban residents live in informal settlements, and you can see the beautiful green and red is the ship flow diagram for Nairobi, where only 66% of waste is unsafely managed. So what we do at Fresh Life is we seek to deliver safely managed sanitation services in these informal settlements, starting in Nairobi. And what we do is we deliver full value chain sanitation services. So we take a circular economy approach and we deliver sanitation services in urban informal settlements. And then we partner with Regen Organics in Nairobi and with utility partners in other cities to make sure that that waste is safely treated. And so to talk a little bit more about that, we have a network of container-based sanitation facilities, and they are a mix of what you see here, the shared Fresh Life toilet, and an in-home version of the product called the Fresh Fit. And we franchise these to entrepreneurs, also in shared residential plots and in schools and in institutions and healthcare facilities. And then we regularly collect the waste. So we go out, these toilets are designed specifically for urban informal settlements. And so you might look at this and say like, oh, those containers are small. Perhaps you could empty them less frequently if they were a bit bigger. And that would be logical in other contexts, but specifically in the context in which we work, it's really challenging often to get vehicles all the way to the site of the toilet. And so these containers are small enough that a person can carry them a reasonable distance to get to a vehicle where it's parked. And then we consolidate the containers that we've emptied around the periphery of the community so that we can pick them up by truck and take them out for treatment. So we work in Nairobi, we work with Regen Organics, which is our sister company, part of the Sanergy Collaborative as well. And in all of the other cities in which we work, we partner with utilities to treat the waste. In Nairobi, Regen Organics produces organic fertilizer, insect-based animal feed, and biomass fuel briquettes. And then in the other cities in which we work, we partner with utilities. And so not necessarily reusing the waste, but working within existing treatment processes to get the waste taken care of. And we've built out this network, over 7,500 toilets and serving over 270,000 people with safely managed sanitation. Quick primer on what we do. And coming back to kind of the point of this session. So we are really, really proud that we can deliver safely managed sanitation services at a lower cost than sewers. That is generally seen as kind of the main option for urban sanitation services. And we're really focused, you might even say obsessed, on continuing to lower our cost per person per year. And we anticipate that we can reach $12 per person per year by 2026 through increasing the density of our operations and improving our efficiency. But our costs are not currently covered by user fees, and we don't anticipate that they will be, nor do we think that they should be. So as I mentioned earlier, we are partnering with utilities in all of the cities in which we work, even Nairobi, which took a while, but we're now formally in partnership with Nairobi Water and Sanitation Company as well. And so I think in the context of this session, the point I really want to make about Fresh Life Services is this is a market-based solution, and it is pro-poor, it's characteristically pro-poor. I mentioned the container design, and sort of everything about the product and the service delivery model is designed for urban informal settlements, for customers living essentially in urban slums. And in order for this to be this market-based solution, which is pro-poor, to be financially viable, there's a requirement of participation and specifically of financial contribution from government. So we work with utility partners that have a mandate to serve their citizens with safely managed sanitation services. And where we really focus is on identifying a cost-effective and affordable way for them to do that. So with that, I will thank you for your time. And my email is there if you have other questions. And over to Elise and Martha. Thanks. Yeah. Your presentation. Thanks.
Yep.
Yes,
Sure is. Good morning, everyone. Come on in here. Thanks for dealing with our tech. Great to see everybody on a Monday morning. My name is Elise Mann. I'm with IDE's Global WASH program.
So this is Martha Gavidio. I'm the WASH director for IDE program.
And we are excited to tell you broadly about IDE's WASH approach to reaching the poor through markets. And then Martha's going to tell you just a little bit more specifically around our work in Ethiopia. So IDE has been around for 40 years, and our founder, Paul Polak, said the most practical, effective way to end poverty is to create new markets that are scalable and allow people who are poor to be the major players. So to answer both of those questions on the Mentimeter, we do believe that markets are
people on Zoom.
Oh, sorry. Thanks. So we do, as an organization, believe that markets are pro-poor and can be pro-poor. So IDE, we operate in 10 countries around the world. Over the last 40 years, we have reached 42 million people through working with businesses and entrepreneurs to build markets for solutions around agriculture, climate change, water, sanitation, and hygiene. And that includes having sold over 2.1 million toilets. And our pillars and how we're really making sure that our markets are delivering desirable, affordable, durable solutions are to start with people. So at everything we do, we want to be talking to customers. We want to make sure that this is something that is needed, that is desirable. And I think markets provide pretty immediate feedback. If people aren't buying it, then it's not a good solution for a lot of different reasons. We're designing to context. One of our strengths as an organization is human-centered design and making sure that we are working with people to co-design solutions that are desirable, aspirational, viable, that we're understanding the barriers, the perceptions, the desirability of any type of sanitation solutions. And that is going to be different in every context that we're operating in. And so the different ways in which we are engaging in market-based approaches depends on where we are, what type of market maturity is happening, and what people want and what's going on environmentally. So we believe that business delivers, again, why I'm here with you this morning to talk about market-based approaches, and that results rule. So using really active data collection and monitoring to make sure that we are engaging with businesses and entrepreneurs to make sure it's both profitable for businesses and entrepreneurs, but also affordable for people. Because if we can't reach people, then I don't know what we're doing, right? So what I want to say in terms of how we're making sure that markets can reach people, we can't reach everybody with markets overnight. There's urgency and we need to work through that for sure. But with our human-centered design work, we always do market segmentation to try and understand the different types of desires, challenges, barriers that people face. So I pulled a slide that is from a recent HCD effort that we did in Zambia to think about the innovation adoption curve, right? So on the far right, nope, you're left. We're talking about innovators on the far left over to the laggards. So we applied the innovation adoption curve to think about where people are and what is desirable. As you see with the innovators category, there's different motivators, right? Pride, convenience, easy to clean, all the way over to the laggards, which is more thinking about avoiding penalties. And so these different motivations for different people. I bring up the innovation adoption curve with some nuance, right? Just because you're in the laggards category, that doesn't mean that you're poor. But there are rich people that can be a laggard that are just less inclined to pick up new behaviors, new actions, new products. But we found that this is a really meaningful way to help segment how we reach people. What types of products are affordable? What is driving people's decision-making? And why? And so when we're talking about innovators through the early majority, we found that this is where market-based approaches can be really effective. People that are falling into these categories have a little bit more means to be able to engage more directly with the market. And as we go farther from late majority into laggards, we're thinking about different barriers that exist and how we overcome those barriers through markets, but also with better targeted and more effective programs. And so now Martha's going to tell you a little bit about how this all applies in Ethiopia.
So the ID Ethiopia sanitation marketing program. So we have been built market for sanitation since 2014. So we use human-centered design research. We conducted prior to building a market to ensure the feasibility and desirability of the market-based solution. So since 2014, we able to work with 264 sales and production entrepreneurs, have been trained in different training, like for example, like the technical skill training for production, sanitation product, and also promotional and sales marketing training, as well as the inclusive financing method. And also we are able to, through these entrepreneurs, we reach like we sold like 26,000 sanitation products, so impacting more people. So among those entrepreneurs, like 32% of the entrepreneurs is women, and we are actually excited to engage more women in the coming years as part of our 10 years strategic plan. So with market established, IDE plan to reach more of like more than 38,000 households with improved latrine by 2026. So we develop a robust market-based business model that drives sanitation access through building market for sanitation. So we leverage the strengths of both private and public actors into the business. So the latrine business owner and the sales agent who are drawn from the community. So they are producing and selling sanitation product and service to the customer, and also health extension worker who are employed government staff, they support the general enabling environment to make the product successful. So we also promote the sanitation and product and service through door-to-door sale using the network of sales agent and also using education from the influential leaders. Also, we use like brochure and billboards to really promote the product and service we have. And also the messaging during the designing process, we identify like key message that resonate to the customer. So we develop a site seller for sales agent to promote those message in door-to-door promotion. And also we, as like the adoption curve, we targeted first like innovators and majority of who are being like early adopters. So those are like model influential community members, wealthy farmers and leaders and members of strong financial groups. So we targeted first them and we continue as it goes. And we actually like face challenge, more of like inflation drive up cost, and also like limited financial accessibility is one of the challenges that mentioned with our market-based sanitation. So we have tested different financial mechanisms to really unlocking access. So we tested direct cash payments. So most ID customers pay 50% of the initial cost when they order a latrine product and service, and also like they pay the remaining 50% where the service is delivered. So installment payment is also other financial mechanism. But in Ethiopia, it occurs informally between entrepreneurs and customers. But in another country, ID work formal mechanism of this financial method. And also we facilitate loans with local institution. We partner with microfinance institution and also with, sorry, with cooperative. So we injected a revolving fund into local banks to initiate loans so that the customer as well as like the business owner to access loans to run their business and buy sanitation product and service. We also work with saving groups, which are village saving loan association group. They engage to support customer to save up money over time for a direct cash payment. And also we are piloting a smart targeted subsidy for those who can't afford buying a latrine product with other means. So we partnership with ID Insights under Wash Pulse 2 program. So ID pilots this latrine subsidy. So I will talk more about the Wednesday session. So you are welcome to join, learn more about our sanitation subsidy program. Markets do not operate in isolation. There are challenges with markets. So it comes down to the economic affordability is a big issue, like when inflation is high, like the raw material costs goes up, that also leads to unaffordability. And also large number of people in Ethiopia will never be able to afford the sanitation product and service. So rollout of subsidy is really significant for us. And also government regulation and policy in terms of like exemption of tax and tariff for the sanitation product importation. That's also other key significant issue for us. So as IDE, we believe that one entrepreneurship can change her community and millions can change the world. This is our motto. And if you have any question, you can reach out to Elise and I. Thank you so much.
Good morning, everyone. Thank you for coming. I will say I am a local, so I live in Durham, but I traveled this weekend, and so I truly appreciate everyone coming here and being ready to listen and participate, because this is a new experience for me. So I am Mark Radin, and I work at RTI. RTI is a international development organization, as well as a research institute that's based here in Research Triangle Park, very less than 10 miles from here, where we were founded by local universities. And so we're really interested in trying to better understand all the different components of how to deliver effective programs and really understand, are we able to reach these lofty goals that we have all decided to collaborate on. And so one of the stories behind this session came from another project I'm not going to talk about today, but I'm working on an integrated early childhood development USAID funded activity in Cambodia. And Elise kindly showed that nice adoption curve. And in Cambodia, we're stuck with the laggards. And there's a lot of activities that have been implemented by IDE with USAID funding, as well as our activity, that really tried to focus on getting these last mile people. So we started having this conversation, and that's really the origin of this. Can we actually reach the poor people? Today, I am going to be talking about another USAID funded project called the Western Kenya Sanitation Project. It's in 8 counties in Western Kenya, and I'm going to focus more on what they are doing and how they're exploring reaching the poor. So Western Kenya Sanitation Project, WKSP, is focused on creating markets for both sanitation and menstrual hygiene products. And so, like any good initiative or any good program, you have to start with the baseline assessment to understand who your target audience is. And when we did our assessment, we found that there is high coverage with functional latrines, very low open defecation rates, around 1%. But many of these latrines do require some sort of upgrade. Thank you. So we're not dealing with people who don't have toilets, and we don't really have to do a lot of behavior change in this location. It's really making sure that people are using toilets that they like and that they're comfortable with. There was also, we are able to leverage a Wash Palace study that did a market assessment and found that majority, 54% of people, are willing to pay to upgrade these latrines. However, it's really unclear on what you do with those other 46%. And you can see here, this graph, those are from 4 different counties that we're working in. And there are some people who are willing and able to pay to improve that. But then there's a host of reasons that people say that they cannot, including both, no, I cannot afford, or it's someone else's responsibility because I don't own the home. So when we're talking about upgrades, what do we mean? As you all know, that the sanitation service value chain has a lot of different components, and latrines also have a lot of different components that influence people's desire to use the latrines. So there's differences between the walls, the flooring, the interface. I think one of the ones I really wanted to highlight here is the user interface. And it's a majority of people, I think almost 70%, have just a simple drop hole like this. And one of the activities that we are most promoting are the Sato pans. We are a technology agnostic program. And so we are not really choosing one, but there is high success with delivering the Sato pan products across the market. It is easy to install and people really enjoy that. But there's also other components, as I said, the roofing and the walls. And these are things that really need to be considered when delivering a whole effective market-based approach. So in trying to build the market, what did we have to understand? So I gave you all of the different parts that we could improve. And now again, it's trying to understand the customers. So something that we all have to remember, and I think we probably know this well, people really truly care about the aesthetics. I remember there was an IDE authored study published a few years ago that found a lot of poor households were gaining access to latrine slabs, but they couldn't afford the superstructure. So they just left the slabs in their homes and they weren't actually building it because until it was the solution they wanted, they would rather open defecate. So really making sure that we deliver solutions that people want is essential for any functioning market and for any effective programming. Cost and affordability are primary drivers of demand as well. It is often that people don't have access to financing. There are seasonal wages, and then how do you align your sales with those seasonal wages and what can you do? However, our program is able to benefit from a large customer base that does have financing or is able to access sufficient capital to make these purchases. So in terms of our general day-to-day, we're not always dealing with the people who are the poorest of the poor, but this remains a question for our activity. Okay, so what is it that we are doing comprehensively to address all of the market facilitation activities? We are doing really three main focus areas. The first one is engaging the local governments and helping them to develop market-friendly policies. So we are working with our 8 counties who are all responsible for developing their own environmental, sanitation, and health policies and trying to insert market-friendly policies or provisions within the existing approaches and regulations. We're also working with the masons and training them on how to better install or improve latrines. A lot of that, again, has to do with the Sato pan, but there's other technologies that we are doing as well. And we're also looking at more of those other products beyond just the actual pan interface. So things like pit liners, digesters, or things that you could add to pits to make it so they last longer or they reduce their odors, but the whole comprehensive package of products. And then the last thing I would also note, we're doing a lot of engagement with sellers and financiers to really make sure that market is working. So we're training sales agents to go out, do door-to-door marketing, do market activations, really engage customers and have those one-on-one conversations. Then the financing one is the one that I think is most relevant to the conversation. So we are also participating in a research study with Washballs 2 that is trying to offer entrepreneurs a credit guarantee so that they have a large enough stock and they could offer their own credits to their own customers rather than doing it through a microfinance agency. This has to do with the fact that a lot of the loans are actually so small value because latrines aren't high enough to really be interesting to most of the banks or microcredit institutions. But it would be a good enough reason for those entrepreneurs to offer credit, but they don't have the credit or the capital to offer credit to their customers. So that is one of the theories that we're testing there. We're also really trying to support business-to-business linkages. So having credit from businesses to other businesses who are supplying the products, thinking that that would allow them to then offer credit to their customers. So looking at across the value chain and figuring out where we can easily supply credit so that then poor people can access it on a lower upfront cost. And that's really important because it's prohibitive for us as a project or for most of the institutions to find those individuals and do this at a household level, because once you have to account for those costs, the financing becomes too expensive and then the interest rates that are charged are unaffordable for the households. And then last, we are also trying to get local groups together to form the VSLAs, the Village Saving and Loan Associations, so they can pool their own money and collectively ensure that everyone has access to a latrine. So in general, how are we really thinking about reaching the poor? So we first start with this assessment, understand what's the potential, what are the issues, what are people thinking about, what is the demand, are there any unique aesthetic requirements for this target customer base? And once you do that, then you have to design the interventions that are going to reach them. Once you have those designed, we're thinking through the financing, as I've mentioned, and there are a lot of challenges there. And I think a lot of us are kind of sitting in that area at the moment. But once those are identified and effective, you can scale it up and make sure that there is universal access. A lot of our challenges, as I've said a number of times, the cost of financing, interest rates vary. They're not always regulated. There's also a lot of risk for those lenders. So they don't all have policies on how to deal with things that are in this price range or with these customers. Government support is uneven and differentiated from national and local levels. There may be policies that aren't supportive of this, and in some places there are. In Kenya, one of the things that we have found is that the health volunteers or the health workers have really started adopting this as an income generating activity, and they are a direct link to the Ministry of Health. So we have benefited from that relationship, but that's not the case in every location. And that's also not the case with every healthcare worker. Some of them are not interested in this activity for a number of different reasons, but those who do see potential of income generation through this are more engaged and have been more effective at helping us identify or overcome many of these barriers. Lack of collateral remains a serious issue. We are exploring a number of different ways to address that, including a potential revolving fund as well, but that is currently in design. And there's a lot of details that get complicated in terms of who manages this, what are the rules and regulations, and what are the incentives for the different actors in the ecosystem. And then finally, there are regulations from the central bank on the collateral that is needed to issue loans. And that also makes a difference. So a lot of the microfinance institutions are unable to, for regulatory reasons, offer the loans that would increase access to sanitation. So our key takeaways are that you really need to have an entire ecosystem approach, and the government really needs to be in the lead. They are the ones who control a lot of the regulations and help design a lot of the incentives that make it possible to reach the poorest of the poor. The private sector also needs comprehensive support. They need to really understand what marketing means. They need to understand whether they can or cannot offer credit. And then we really need to empower local voices because they are the ones who have often the most effective or aesthetically pleasing or interesting solutions. And when they are empowered, it makes it a lot easier to get all the people who are our potential customers on board. So thank you for that, listening to this presentation. I am going to then lead us to our next activity. I'm supposed to do that. Right. Okay. Our next activity is we're going to do a little of a breakout because again, this is Monday and the first session, and so we want to hear from people. So the purpose of our presentation was to give you guys some information and try and think through whether or not we are reaching the poor, are we missing them? Are these effective ways for getting them? And we are going to try and do, I think, little breakouts. So I think what do we think is it for? If people could get in self-segregated groups, if you wanted to do like 10 or so people, go ahead and we're going to ask you guys to decide as a group what you think. Are the markets pro-poor or not? And then come up with your main argument. And then we're going to come back and have everyone share, have one representative of that group share, and then we're going to vote again. And we're going to see if this conversation has changed anyone's mind. And if it doesn't, that's fine. And if it does, that's also going to be interesting. But this is a really free-flowing idea conversation time because I don't think any of us have the true solutions. And even the 4 of us who have presented probably have differing opinions on whether markets are effective at reaching the poor. So we're going to ask you guys to get into groups of whoever's around you, and then have one person be the rapporteur and then report back. We're going to give you guys, I think, 15 minutes so you can first introduce yourselves before talking. And once you guys share back, then we'll have our donors provide some final thoughts. And then if there's time, open it up to Q&A. So please go ahead and get into your groups. And people online, please share in the conversation in the chat. Okay, thank you, everyone. So Ruthie is gonna walk around to all the groups and have the rapid tour, so. Okay, Ruthie's coming to the back, so people in the back, be ready.
I saw one big group back here. Can the rapporteur for this group identify themselves? We had somebody back here. You didn't
The
decide.
group in the back left
Your
corner.
group? Oh, interesting. Do we have two people? Would you like have like two groups involved? Yeah, that's. Great, perfect. Thank you.
All right, so I'm Richard Moore with Water4. I was on the pro market side, so I was making the case from the perspective of what we do, as well as some of my personal beliefs that market-based solutions can and should be used as a means of alleviating poverty, of lifting people, poor people out of poverty. One of the things that I mentioned as part of this conversation is sometimes it's good as when we're talking about the poor, to also talk about what level of poor people are we talking about? Are we talking about people who are living in extreme poverty, people who are living on $3 to $6 a day? I think part of that is important as part of these conversations as well, to give us a good picture of things. And another thing that I mentioned and talked about is just looking at the amount of resources that are available through Western aid and nonprofits, as well as government money. There's just like not actually enough money available over the next 10 years to provide everybody with universal access to sanitation and water services. So looking at market-based solutions where we can, where it works to help drive impact and change in sanitation and water.
Was there a presenting? Yeah, there it is.
Philip meets up here. Hi, I'm Alison Parker from California University. So we also have some views expressed that all our sanitation, like my sanitation, is provided by government subsidy. And the role of governments and we think there's not enough money, but do we need to be arguing more for better prioritization of resources? So I think we didn't want to let governments off the hook. I think there were kind of two sides to the argument as well.
Thank you so much. All right, there was another group sort of in this region.
Back right corner, there was this group that was standing. Ruthie.
Standing group. I see some people standing. Ready to be part of the standing group? I'm volunteering. So we get to decide. You're the one speaking.
So I'm Phoebe Rich, I'm with Aqua Research Inc. And we're actually we provide on-site chlorinators to make water drink or surface sanitation for hospitals. And our conclusion was that market-based approaches can be pro-poor, but they're not really set up to be pro-poor because there needs to be capital that is lacking. I mean, it's a financial problem, and without that initial capital to get solutions rolling, and there's a disconnect between the impact and the way in which it generates revenue is not necessarily connected to treating water or bringing sanitation services. So it's a disconnect. There's opportunity there, but the structure, the message has to be different.
Great, and move this way. We had this kind of circle group. Can I get a representative from this group? There we go.
Thank you. My name is Alicia Ofori from Cranfield University. I think we ended up asking more questions. And one of the questions is, what do we mean by poor or pro-poor? What is market-based? And so that's what I think we would need more time to get to that definition, but I think we wanted a clarification on what it means to be what something is market-based approach. So for instance, somebody raised the point that if there are subsidies involved, then it's not market-based approach. how do you segment the markets to define who is actually poor? So those are the questions that came up during the discussion.
Thank you so much. And
This is a group,
there was a group over, yeah.
There's two groups here.
Zone.
don't skip one.
Oh, we've got notes. Are you?
Oh, yeah, sure, I'll do it. I'll start.
Wonderful.
Yeah, hey, Mark Elliott, I'm at the University of Alabama. I guess our consensus, we had a consensus that market-based solutions are definitely a part of a pro-poor solution. But often subsidization is essential for some segments of the population, just to be realistic. But the potential of markets to drive down costs over the long term to lead to economies of scale. And then Jennifer had something she wanted to say about the curve of the adoption timeline.
Thanks. I'm Jen Holthouse. I work for Windrock International, and I'm working on a project in Ethiopia where we're demonstrating a business model where rural communities of 10 to 30,000 people can purchase their own solar pump for drinking water supply and pay it back over 3 years to local solar developers. And by peeling off that pump part of the water system, that's a lot less problematic than diesel. And I think when I look at that curve, that was really helpful for me because the front part of that curve is potentially people or communities that could be served by market mechanisms. And we're doing a disservice if we're not providing those mechanisms, and we will always require subsidies and support for the back end of that curve. That was my insight. So thanks for that.
Great. Now, Mark seems to think there was another group in the back.
Right in between.
Yeah.
Oh, yes, the
Yes.
Lisa's group. Yeah, we'll pass this. Do we know who's gonna speak? All right. So, Ella, academic representation.
Hi, my name is Whitney from the University of Colorado. I also interned with Fresh Life over the summer. Our group had some similar sentiments of what has already been said, particularly emphasizing that markets maybe have the opportunity to be pro-poor, but are not inherently pro-poor. Particularly focusing on the fact that there definitely still needs to be government involvement and an expectation of people who are low income being exclusively served by market-based solutions where the government is not involved when that's not even the case in high income countries is really infeasible. So we wanted to definitely focus more on continuing to have government involvement and support there. As well as similar ideas around really more defining what it means to be pro-poor or poor rather, and kind of understanding the metrics around that, as well as kind of messaging and what that maybe looks like, or sentiments that can portray to others. Thank you.
All right, and one more group up at the front that Martha was in. Excuse me, I picked it. She'll pass. Up here. Great, thank you.
Megan Lindmark with COVA. So similarly, we answered a yes, no question with a maybe. We feel that, of course, markets can be pro-poor, but they require intentionality to do so. And I think the biggest question that we had was around financing. How do you actually ensure that those subsidies are available to reach kind of the lowest levels of the pro-poor, or of the poor communities? So those were the main points that we had, yeah, just that there are a lot of caveats and we had a lot of questions about how that could really be done, so.
Thank you for all of that. Right before I introduce our two last speakers, I just had a quick question. Can you raise your hand if you identify as an economist? Interesting. Yeah, thank you. The reason I asked that is, as from an economic perspective, I think one of the questions we also have to ask is, what is the market? And I don't know if everyone is aware of what externalities are, but externalities are things when other people may enjoy the benefits or the cost of what you're doing. And something that's really important to remember for sanitation is you enjoy benefit if your neighbor has access to sanitation. And what standard economics would say is when there are externalities, there needs to be additional policies or things that help incorporate their externalities into a market. So one way that could happen is if you had subsidies, how you figure them out, how you target them are all very valid questions. But that would be an economically friendly way to better help bear the costs and benefits and target those costs and benefits to the numerous people involved in a market. So I just wanted to add that, and I encourage people to just read about market failures and externalities when thinking and exploring this question further. So with that, can I please invite the two last speakers up to give some thoughts? Jesse and Lewis from USAID and the Osprey Foundation.
Here, they can sit.
They want.
Yeah,
Do you want to sit or stand?
Let's see. Let's see.
You know, it's bad enough being at a university for an 8:30 class, but getting Econ 101, really a bit much. Okay, I'm Louis Borstein with Osprey Foundation, and I will admit to knowing at least two of the presentations quite well. I've had a long history with Fresh Life, where both as a funder and previously as a board member, and ID is an organization I've known since Paul Pollock was alive, and doing really interesting things. And I learned about the latest work that Mark and his colleagues are doing. I'm also was really intrigued to see how the circles managed to come up with a lot of the points I was going to make. So I'll just shut up. No, what I will try to do actually is to take some of those points and provide a couple of overarching themes here. The first is that anything you do needs to be financially sustainable if you want it to last and to scale. Does financial sustainability mean that it has to be completely commercial and so fully able to fund itself? I would argue no. I would argue that it has to be financially sustainable, but there are things that are financially sustainable that do get ongoing subsidies. If you want it to be financially sustainable and it is not fully market-based, then what you need to do is know where your the subsidy is coming from. So for example, in the case of Fresh Life, which I know well, that subsidy is currently coming from a combination of foundations like Osprey and large donors like Grand Challenges Canada and the French government. Eventually, that subsidy needs to be paid by the government for the reasons Mark explained very well. It's a public good. There are positive externalities from everybody having good sanitation. Hopefully, as one of Ruthie's slides showed, over time, the amount you're asking the government to pay is dropping. And the government would look at that and say, wow, this is a really good deal. I can put money into this and I'm going to avoid all sorts of health problems and do other things. So financial sustainability is essential, but it doesn't necessarily mean that it has to be fully commercial. On a related note, having been in the business for, I don't know how long, 20, 30 years of playing around with market-based approaches, I started my career at a place called International Finance Corporation, part of the World Bank that does market-based work. I would say that a lot of people see the world either as fully commercial or as charity. And the place that we're talking about here, that everybody is talking about here, is somewhere in between. And for some reason, some people get that and some people really don't. And I have tried over the years to explain why, and one of the interventions just now said, there are real advantages to using markets. Markets can make things more efficient. They bring costs down. They can make it cheaper to serve people. But just because you're using a market-based approach, and somebody said if it's market-based, it can't have subsidies, I completely disagree. I love things that are market-based and pro-poor, and that fully cover themselves. When you can do that, that's the best possible scenario, but there will be market-based approaches that also require a subsidy. So it's, but that can be challenging for people to understand. The second point, which was illustrated really well by something Ruthie talked about, is sometimes there are trade-offs between reaching more people and people who really need to be reached and profitability. You know, it's, I mean, we could go back to Econ 101 and talk about the elasticity of demand. Now I'm really turning people off. It's interesting. Osprey has at least three current grantees: Fresh Life, a group in Rwanda and also in Uganda and a little bit in Kenya called Earth Enable that does flooring, affordable flooring, and another group in Ghana called Saha Global. All three of which have made a very clear decision to serve more people, even though in order to serve that larger population and get them the public good, which is, you know, can be better sanitation, clean flooring, safe water. They know that if they want to reach more people there, they're not going to make as much money per person. And they need a subsidy to do it. But they believe that using the market-based approach and having a viable source of subsidy is the right way to go. And there's a lot of learning going on in this space of trading off between, if you will, the social benefit and the financial return, between the scale and the profitability. So that's something we're thinking about. And if you're running a market-based effort, or you're running a social business and you find yourself in that position, you're not the only one there. And it makes sense. Third topic is market-based approaches are different. We fund a lot of work on systems change, and we fund big NGOs, or not necessarily big NGOs, but organizations that are very much focused on systems change, like IRC from the Netherlands, Water for People, WaterAid. Those sorts of organizations, they typically will go in and have what they call a district-wide approach, where they come in and they want to get everybody covered. If you're taking a market-based approach, and the one I know that actually wasn't mentioned today, but it's IDE's work on rural sanitation in Cambodia, which is an amazing story and well worth learning. And that curve that you showed, you know, totally applicable there. That approach uses a very different thing, which I call the wave approach. And the wave approach basically says, let's see who we can get to buy the product on a, you know, just for cash. Then there are going to be people who can't afford it for cash, but need some sort of loan, and then they can afford it. And then there's going to be a bunch of people, as was mentioned in Mark's presentation, there's a bunch of people who can't even afford it if you lend them the money. They need a subsidy. And so one of the things that IDE did in Cambodia over at least 10 or 15 years was to follow that wave. And the last part of the wave was one of the few social impact bonds that I've seen that actually works, where the Stone Family Foundation put up the money and USAID came in to provide the subsidy on when the product was delivered. So, but that reached the part of the population that otherwise hadn't been reached. So market-based solutions can go to scale, but it's a different type of approach, and you need to think about it that way. I'm almost done here. One of the things that I do think is important, we had an interesting conversation with some friends at CARE last week, because they're looking at market-based solutions for sanitation. And they're trying to figure out how they can do this. And one of the things that we talked about was that there are preconditions for success. If you want to do stuff on a market basis, you really need to understand, you need to diagnose the markets that you're going into, which I think we saw a lot of in the presentations, and you need to understand it. In many cases, obviously you need the demand to be there, and sometimes you need to stimulate the demand. One of the things that happened in Cambodia is that demand was stimulated by something, a program that doesn't exist anymore called the Water and Sanitation Program from the World Bank did 15 or 20 years ago, before all the market-based work came in. So you can't just focus on the supply side. You need to think about those three parts: demand, supply, and enabling environment. And you gotta have a good enough understanding of those to do it. And finally, I'm going to mention two resources here, since there are a lot of students and academics in the room. There was a study published 10 years ago called Beyond the Pioneer, which is where they looked at a bunch of different market-based approaches that were trying to reach the poor in multiple different fields, and came away with a very useful framework for how to go about this work. And so just Google Beyond the Pioneer, you can find it. It's now sitting with FSG. When it was done, it was with a different group. But and finally, a book was released earlier this year, beginning of the year, called Scaling Up Development Impact. And it's written by a woman named Isabel Guerrero and some co-authors. I think she's a professor at Harvard. She was at the World Bank for a long time. Really one of the most useful books for how to think about this sort of work. So sorry for the long intervention, but there you go.
Thank you, Louis.
Yeah, thanks, Louis. You took a number of my points out of my mouth, so hopefully I'll be a little shorter. Unfortunately, we agree on a whole lot, but I'll try to offer a couple more points. I think what I first found interesting is the results of this survey. And I'm not an economist, but I bet an economist would say, if you get the results like this, then you're not asking the right question. You need to reformulate the question. And the question I asked my small group when we were discussing was, is there any scenario at serving the poor that does not involve the market-based approach to some degree? Because at USAID, and I agree with Louis, we define a market-based approach as one in which the customer, the beneficiary, is providing any payment or input into the eventual benefit. And so that could be in-kind support or some cash support that doesn't eliminate the possibility of subsidies direct to those households or in the environment, in the ecosystem, market ecosystem at all. I would say that's still a market-based approach. And given the numbers we look at and the amount of financing in the sanitation sector that's even available to invest, it doesn't seem possible. There is no scenario, in my opinion, that does not involve the market-based approach. And so I think we all need to think about that in terms of how we approach improving this for the poor. I think you brought up some interesting questions. I'll offer another one. I think there are also other trade-offs when we talk about sustainability and our patience, right? We've set SDG goals to reach universal access in some short time periods. And the market-based approach in the experience I think shared today and others, it takes a long time, right? And especially if you're going to do this wave approach, you're going to build the market up, you're going to sell toilets, and you're going to start introducing new mechanisms, changing products to reach everyone successively. It's going to take a long time. And do we have the patience? If we're able to reach, and is it just to wait until the end to reach the most vulnerable, the poor and vulnerable? I think that's a question we need to grapple with as we think about sustainability. Also, as you sell toilets and saturate the market changes, right? You no longer have these giant markets for building toilets, but maybe that shifts to maintaining toilets, or people want new types of toilets, or new markets exist and migration exists, and all these things constantly shift the market, and it constantly needs to change. And that has an impact on sustainability as well. The last thing I'll say is we often talk about market-based approaches. We say supply and demand, but even the discussion today in this room about financial mechanisms and subsidies, that's not really part of something else. That's part of the broader ecosystem of the market. That's the business environment. And since none of you were able to attend the simultaneous session in the other room that was on sanitation business environment.
Unless they're online, maybe somebody online is watching both.
Yeah, possibly there's a couple of those. Fortunately, I manage the Wash Pals 2 project, and so I'm aware of both elements of research. And one thing that was we did a big survey to try to better understand the sanitation business environment. We interviewed a ton of governments and implementing partners and those working on market-based sanitation. And the results are kind of striking. It turns out that when we invest and try to do market-based sanitation, people are basically, governments and implementers are doing what they know how to do and what they feel comfortable doing. But they're not taking on the things that they don't know how to do and that are challenging. And that is generally the governance and the broader business environment pieces. They are working on new products and demand, right? And I think you've heard some of that from the projects. But dipping our toes into these broader issues of how to sustain and grow and strengthen the market by working on the financial mechanisms, the policies, the public goods, and knowledge of the market is super important. And I would really challenge everyone to not shy away from those things as we try to move forward and improve this. I probably just stop there because we're probably out of time. But I thank you all, and I love that the answer is depends, because that was always my response to these type of questions. Thanks.
Thank you, Jesse. We actually have time for 2 questions. I'm just gonna let the audience ask, and you can ask any of the presenters if anyone wants. Lisa's gonna be the moderator, so please raise your hand.
I guess I'll ask both of you. My grandparents, they came over here, from another country and got into drilling water wells and stuff. And the way they would handle poverty is if they came upon a person, they had some land or something of that nature, they would let them give a cow or give a chicken or, eggs every week, something like that. And I think that could be applicable in Africa as well. And their business strategy was that get some skin in the game, get them where they're interested in paying the bill and getting it over with. So I don't know whether USAID or the foundation, Osprey Foundation, has considered that, but it worked here in the US. That's over 100 years ago.
Oh, I should say
Let me grab one more question.
Oh, come on, folks. You
No
guys are so talking so much in the small groups. Come on. No question. We did our job. Nobody's got any questions. Yeah, very good.
Hey, thanks. So it was really interesting, and quite new to the world of WASH and particularly economics, background's mostly in data science, but I just wondered when you were saying that majority of successful projects adopt a kind of hybrid approach where there is a degree of market-based solutions and a degree of subsidization. It's how are the ways in which you can usually measure or assess how successful a particular project or approach is, and are there any ways which you think are particularly effective at defining whether or not a particular approach is successful in a given context? So, thanks.
One more question.
Back there, they said it, and you mentioned it too, is how do you get, you want it to be market-based, but then you want the government to take over. So if you have any suggestions on how to convince the government to prioritize water, they don't. I mean, in Central America, I live in Central America, it's really hard in Africa, and sure it's even worse. So any suggestions on that, or if there's any conversations of that, sessions on that, would be interesting.
Who wants to start?
To the first question, I would say that one of the things we've learned is that trying to professionalize the provision of WASH services is really important. Trying not to do things and assuming that a community will do it for themselves. But a lot of what you're seeing here is, if you live in the US, you have utility and it's hopefully a reason, most places, utility and hope is reasonably professional approach. And I think some of the more successful things we're seeing for the poor in urban areas and in rural areas is the professionalization of those services. And we don't dictate how the folks we fund do that. They know their markets and we let them do that. On the issue of how do you get government to do it, I'm gonna let Ruthie talk about that. I will say this. One of the challenges of being a social entrepreneur is you come into a situation and you have an idea about how to solve the problem, but you don't know how to do it yet. And then as you develop over time, you actually learn a lot and the way you work changes. What can happen in the first place you work, like Nairobi, in the case of Fresh Life, is that the government gets used to seeing you there and is, thinks, oh, they're solving a problem for me. And then over time, you come back to the government and say, oh, by the way, actually, you need to help solve the problem. It is easier if you're going to take that approach, if when you start in the location that you get the government to partner with you. Because otherwise you end up in this situation that's very challenging where they are really quite used to you doing it for them. Fresh Life started over 10 years ago, and in the last month, they have finally signed an agreement with the government of Nairobi about how that how to do the work. And Ruthie could give you chapter and verse on why, what it took to do that. But I guess the only thing I can say is engage the government early. It's important.
I can just give a couple of, I would be so happy to talk about this more. And I think just in an attempt to give a couple of key points, how to get government to prioritize this is to make it affordable or give them away. So I think I have a personal compassion practice of just trying to really allow myself to remember that government wants to serve its citizens and that this is about not passing judgment and just sort of saying it would be really challenging. If I had no possible way to afford the thing I'm supposed to do, I'd probably turn away and focus on other things. So one of them is really give them away. And I think that relates to another, which is just sort of understand what they're struggling with. We ended up getting pretty involved in helping our government contacts think about how they could develop policy that was going to be conducive, that was going to enable organizations like us to function. There's always sort of the idea of working with regulators that if they can't get away with not doing it, perhaps they won't. And then the last thing, which is really, as Lewis was mentioning, we started in Nairobi in 2011 and just signed our MOU. And I think ultimately this partnership and really showing, right, you're right. It's a game of chicken. We're not going to leave. We're not going to stop serving our customers. But we did go to other cities in Kenya, secondary cities where Nairobi is the capital, and we signed MOUs with the government. And so I think that had some impact, that actually we learned our lesson. We didn't start in any new cities until we had partnership with government. And eventually 3 MOUs with other cities that may have had some effect as well.
I'll just add quickly. I mean, I totally agree. Nothing without them is sort of one of USAID's catchphrases now. You have to work with the local authorities. I think the tricky thing with market-based sanitation is making sure that we're being very effective and efficient with whatever investment or time is put in. It is very easy sometimes to jump and go, oh, well, we'll just give away toilets then. And when we have a lot of evidence, for instance, that does not work. And so directing, working with partners and directing them to what we do know about is the best investments, I think is part of the role of the international community. And I think to make government care about it, we have to show that it's a good investment. We need to show the models to get there. I think that's part of one of the big gaps that remains for us and why USAID invests so much in this area is we have some isolated success around the world with these approaches, But really how to deploy them for everywhere is still totally unclear. We need to figure out how to layer and sequence these market-based approaches with the other investment. And that's really another challenge for all of us. And then you need to get constituents to demand the service. Some of the work we do focuses more on organizing citizens to demand from their government certain things, and that will also motivate those government to invest in it.
I mean, just quickly, oh, sorry, go on. Go.
Yeah, in Ethiopia, as I mentioned in my presentation, like we partnership with ID Insight about to understand like the timing of like introducing subsidies. So we actually like drawing evidence from the study. So it's ongoing because like the government is really afraid of a potential market distortion about like introducing subsidy with low like coverage of sanitation, improved sanitation in the area. So, I mean, early engaging government is very critical to understand, even we face challenge, even to pilot this research about timing, like when we introduce, we didn't get buy-in some area part of the government, but still keep them engaging to really draw evidence for like when and how we can target even for subsidies.
Really quickly, we did not answer the question about measurement, which is a really important really important question. There are different metrics you can use, and I would say that in the case of sanitation, being clear about the number of people who are being served with safely managed sanitation and being clear that you're getting the shit out of the environment are really important metrics. It happens that one of the strategies of Fresh Life to get to scale is to start working on a results-based approach. And in fact, this quarter is the first quarter when Osprey is shifting its funding, some consternation of my back office colleagues, from a grant-based approach to a results-based approach. And Osprey is working, Grand Challenges Canada is also doing that with us with a little support from a wonderful Australian group called Who Gives a Crap. They sell toilet paper. So we have very specific metrics and a 22-page annex defining how all that's going to work in process that may be a little more complicated than it needs to be, but we'll make it simpler over time. But yes, we very much think about that. One of the challenges with sanitation is if you wanted to use a health metric, you have to get to really, really high levels of coverage before you start seeing a population-wide health benefit. We know that there are no healthy communities in the world that do not have safely managed sanitation, but you've got to have upwards of 85–90% coverage. So we do not ask, we are not looking for a health impact. We're looking more at outcome metrics, but we are quite certain that if we get those outcome metrics right, and we see the things scale up, that we will eventually get the health impact.
Thank you, everyone. I guess I'll add one last thing. Another really good metric is the survival of sanitation businesses, because if they continue, that means they're doing well. But on that note, I want to thank everyone for attending the session, and thank you all our speakers. Enjoy the rest of the week. Please come up and ask us any more questions if you have. Thank you so much. Can we take a picture? Yes. Can we take a picture? Just one.
Yeah, we have, yes.
We shake down the button. Okay, so do an angle like this. Okay, we'll do an angle.
It's not really like that.
We'll go for this.
I don't really have a.
This side, it's on your face. Why don't you? I don't need to know. We're fine.
How are you? Nice to meet you. I know exactly. It wasn't that bad, so. It was only like an hour because of rain, so we were playing on the tarmac for like an hour, but other than that, not bad, yeah. I think I was like 6:37, the whole time around 7 yesterday. Yeah. Yeah, it was like, it was kind of like, oh, we should be looking soon.